Hello everyone. Happy to see all of you in Asia. My name is Putu Hadi. So as you can see in the chat, our agenda today's session is update of Dia, and then I will update of access and control group. And then Dr. Sak, next session is update of country coordinators about template creation, and then followed by Yilin about HMIS comparison, and then Misha will update about special issue, and then the last session is questions. And is there any other business that want to discuss in this session? As always, try to keep your mic mute during presentation to prevent background noise. If you have any questions while the presentation is going on, please type them into the chat box, or you can raise your hand. So I will now hand over to Professor Miriam to lead the session. Professor Miriam, over to you.
I think Professor Francesca will lead.
Yes, thank you, Prof.
Okay. Okay, Professor.
Thank you, Putu, and hello, everyone. It's good to have everyone here again today for our regular Tuesday meeting. And I would like to apologize for starting the meeting room late. We had another important meeting on the same channel. And even though the other one tried to hurry up and round up, but we still find ourselves going a few minutes, about 1 or 2 minutes over the time. So I apologize for that. We have quite a packed agenda because there has been a lot of activities from the different subgroups, the technical and the operational groups of this project. So like Putu had announced, we're going to be having the updates from these different groups so that we know where we are. We may need to take some other technical decisions or inform you of some other technical decisions that we have had to take on behalf of the project. Thank you, Putu and Aliyah, for putting this together every week, and thanks to everyone who has made it here today. I have apologies from Professor Bernard from Zimbabwe. He is meeting with the director at the Ministry of Health on the VODAN Africa project. So I told him it's fine for him to go ahead with that meeting, that I will give his apologies. And if he's able to join us before we conclude the meeting, that is absolutely fine. Putu, I'm going to hand over to you to take on the agenda. I think the next thing is on the updates on the localization. That is Aliyah, for Aliyah to give an update on the Monday meetings. We had a meeting yesterday. It was quite an eye-opener with Samson. We had some technical presentations from Samson. So perhaps, Aliyah, you'd like to update us, and if there is need, we may have to invite Samson to make the presentation of yesterday. Aliyah, please.
So,
Aliyah.
hi everyone.
Yeah.
Great to see all of you here in our usual meeting. So basically, I can give a short summary, and then maybe Samson will add to that if he wants to add anything. So basically, yesterday we had a technical meeting having discussion on the all components that we now launch. Specifically the CEDAR embeddable editor and the VODAN portal, and then also local repository that we're going to use in hospitals. So basically there is an ongoing decision on the technical deployment of the architecture. So we are waiting for the another training this Friday for the technical team. So basically, then we'll probably have more and clear answers for our questions. But for now, it's still ongoing process. Yeah. So I don't know. Maybe Samson will add to that anything. Samson.
Yes, thank you, Aliyah. I think Aliyah summarized it well in short. It's about the minimum viable product that we are developing that will be implemented on each of the clinics. And the decision is on how we move forward with templates that we are creating, with terminology services that we are planning to develop. That is the VODAN portal. We proposing two options. One is to develop an application around the CEDAR embeddable editor. The other option is to make the CEDAR system itself to be customized to our needs, and we are exploring on both options while making some developments on each of the aspects of the development of the minimum viable product. I think we will have a presentation next week also with clear insights on which direction we are moving. I think this much is enough for today. Thank you. Over to you.
Yes, so thank you very much, Samson and Aliyah, for that update. To also further reinforce that to the members of our community, now that we have gotten to this stage of consideration of actual implementation in the clinics and health facilities that are ready, we have the option of continuing to develop around the embeddable editor, or now to do a fully localized CEDAR. So by next week, I expect Samson and Getu will make a presentation, and we'll also see the progress that has been made in both. Who knows, we may actually end up adopting both. But for the Monday meetings and then the trainings of Thursdays, we expect that the training will continue with the data steward. And then by the time we are ready to deploy, then we should go to the training of the data clerks in the hospital. We should have all those technical decisions have been made, and then we have actually have now a technical tool of ours, the localized technical tool of ours, based on all the other consideration of the facilities that we are able to provide, and then the best path for the either the embeddable editor or the CEDAR local CEDAR infrastructure in the clinics. I will invite Aliyah. You have an update to give on the templates group as well. So I guess you'll still have to continue speaking.
Yeah, sure. Thanks a lot, Professor Francesca. So basically, update on the templates. Yeah, so we had a training last Thursday and focusing on more vocabulary creation. So I also received assignments from data stewards. So basically, I'm providing feedback for all data stewards that have submitted their assignments. And now we are launching a round of meetings with technical coordinators from each country in order to make VODANA, to create a VODANA common list vocabulary sheet, and then vocabulary related to like country-specific vocabularies. So there are two approaches that we are approaching now. So making a country-specific vocabularies and then a common list vocabulary. So and then on the template itself, yeah, it's going well. I'm in contact with all technical coordinators. So yeah, that's probably it from my side.
Thank you, Aliyah. Just to add to that, over the past few days and including yesterday, I made a round of the countries, and I can confirm that Liberia, the template has been created, and that of Nigeria as well. I have spoken to the data stewards in Uganda, but I guess I'll have to get that information from Mariam to know if we have a country template for Uganda. But I know Ernest is writing exams, so he's not here, but he actually already communicated to me that he has completed that of Liberia. I don't know who is manning that of Tanzania.
Sorry, Professor Francesca, we actually have a template for Uganda. Sorry to interrupt you.
Excellent. I'll update my list and my report for Uganda, Liberia, and Nigeria. Aliyah, can you tell who is in charge for Tanzania and then Somalia?
For Somalia, it's Tihist, and for Tanzania, it's me.
Okay, so I guess for you, of course, I know that is a given. And then Chikis, I'm sure I'll reach you after this meeting as well so that I can get.
So on Sunday we had a meeting with Tihis. So she already showed me a template, OPD template for Somalia. So it's created, and we kind of discussing the vocabularies which we have to incorporate into the template. So basically, it has been created. Yeah.
Is available. Excellent, excellent, excellent. And we have Somalia and Uganda. Oh, that's great. Thank you very much, Aliyah. Thank you for all the excellent work, and of course to the technical coordinators and the data stewards in these countries. We are grateful for the progress you have made on the templates. Next, we'll call on Putu to give an update on the access and control activities of his group.
Thanks, Professor Francisca. So I will share my screen right now. So yesterday, as always, we had a meeting with the country's coordinator and also health facilities communicator. And this is the first update is about update communication. This is the overview of the communication update. From Uganda, Mariam will organize to have a meeting with the facility heads next weekend. And from Kenya, William is still waiting for response from Ministry of Health regarding the county health facilities. Fred will go back on Tuesday morning. And from Zimbabwe, Kuda wasn't update the last condition. So this is the last week update. So booked to meet the provincial health information officer for access to facilities. And also from Somalia, Asia had trouble in her internet connection. So the last week update is already introduced Asia as facilities communicator to 5 health facilities, and now waiting for the last approval to start the project. And from Nigeria, Abdullah is still waiting for the introduction from Ministry of Health to get MI WCC on board in the project. And the last update is from Ethiopia. It is all health facilities have been contacted and 20 data steward assigned. So it's not only the update of communication right now. This is the second update is about OPD form. So from Uganda, got OPD form from KIU, and all of the health facilities use the same format. And from Kenya, William still waiting OPD form from Zambezi and Beacon Hospital, but private hospital usually have their own OPD form. From Zimbabwe, Kuda wasn't update the OPD form status for me, and also from Somalia. And for Nigeria, got one the OPD form. Abdullah sent it to me, and he told me that it is easier to get OPD form after the letter of introduction. However, there is a difference between health facilities OPD form, and the last one from Ethiopia got the OPD form, and the health facilities use the same format. Abram already sent the OPD form to me. And right now, not only to communicate the health facilities to gain more health facilities to join the project, but right now I encourage to touch the first round of question. We have a communication topic list that that split into the 3 round of question. So we should move to the first step for the health facilities that ready to go. So right now we should ask about the we should identify data stewards, and the next one is the number of OPD register and number of functioning computer, and number of data clerk and internet connection, and use HMIS or not, and what is the HMIS. But this is only the general topic of the first round communication topic list, and country coordinator can see the complete version of the topic list in bit.ly for the for the interview tools. So the next plan is so we have 2 parallel activity. First, to continue to communicate with the health facilities, especially the health facilities that need a letter from Ministry of Health for introduction or approval. And the second activity is to move to the first round of communication topic list to identify the general information of health facilities. And after the country coordinator collect that kind of data, I will collect the result and will document that result in the Google Drive, so we know the general overview of each health facilities that ready to go. So start from now, the weekly report every Saturday is not only health facilities communication update, but also round one result, and if there any issue when the country coordinator collect the general information of health facilities. Back to you, Prof. Francisca.
Yes, thank you very much, Putu, for that comprehensive report. I just have a couple of questions to ask you to provide additional information on the data processing agreement. Do we have all of them now for all the countries? The data processing agreement. I remember you sent that of.
Oh yeah. It's the last data processing agreement is from Tanzania, Prof. I think I forwarded to you.
Yes, I received that. So that is the last one. We don't have anyone outstanding. Then there is also the question of the health facilities agreement with VODAN Africa. Do you have an update on that as well?
Not yet. I think we will discuss about that for the next discussion. It's about the health facilities agreement, so we still not touch that part, Professor Francisca.
Thank you very much, Putu, for that update, and thank you for the good work. I think next we have the update number 4, which is from the Machine Learning Pipeline and Dashboard Group led by Dr. Sakinat. Rudwan has a presentation on dashboard technology and creation. Rudwan, we think.
Yes. So we discussed this before, right? We are looking forward to the dashboards to implement them first as prototype and then later inside the architecture. Our next step forward is to speak to John about the exact technology we'll use. And we believe we'll have that confirmed around next week on Monday. So that's the first step we'll take. And after that, we'll start prototyping with that specific technology. It's probably going to be React. And so we're looking forward to that.
Thank you, Rudwan. Do you also have a presentation on terminology?
Yes, I believe that will be around the end, right?
If you're ready now, that is fine. Otherwise, we can move it to the end.
Yeah, that's fine. I'll do it around the end because I have some questions to propose. And I think it's good for people to kind of think about that.
Right. Thank you very much, Ridwan. Dr. Sakina, do you have any additional information to give on the dashboard group? Dr. Sakina?
Yes, good afternoon, everyone. Yes, no, not really. I think Rudwan has given us all the updates that we need for now.
All right, thank you very much. So then we take the updates from the countries. We start with Dr. Wondimu from Ethiopia. Dr. Wondimu, please. Is Dr. Wondimu on the line? I think I remember when he joined. Yes.
Yes, good afternoon, good morning all. Just to give the update already, Putu reported all health facilities communicated, and also we have developed action plan. We need to discuss the action plan ahead of time with Prof. Francis, with you, and also with Prof. Miriam, because we need to assign each role and responsibility in timeline for the implementing health facility, and also for the university, and also for from our side for the coordination. So maybe we will discuss this this weekend, this week, and then start the implementation of the project. So this is a brief update from my side. Thank you.
Thank you, Dr. You also look out for the health facilities agreements, which Putu is working on. It seems Ethiopia is more like ahead of everyone now, since you already have the health facilities on board. I think the next step, they will also need to get the questionnaires as indicated by Putu, and then to also sign the health facilities agreements. So in case you want to start off with the implementation. Thank you very much. Dean Jamal, would you like to give an update on the
Yeah, thank you so much, Bro Francisco. We in Somalia, we have the health facilities are ready. We are communicating with health facilities. We settle with them. We are meeting the project, the objective of the project, and they are ready right now. We are about to start the implementation. Also, we have a plan to have a meeting with Tristi to finalize the template and also the vocabulary of the Somali vocabularies. So I think within this week we can finalize the template and finalization of the template vocabulary. So also we had a meeting with the director of planning, and we updated about that we need an agreement with the foreign agreement. So we agreed that to come up with the template, and we are waiting. I think last week we agreed to have some template to sign from the Minister of Health, or if we can have some layers, for example, some agreement with the health facility or regional health office or pro or central Minister of Health central level, it was good. So we have a meeting for the director to update that, and we agreed with him, and he waiting from us to share with the template to sign from his side. And otherwise, we are in good position, and we are about to start the progress, the implementation. Thank you so much.
Thank you, Dr. Jamal. Thank you for the excellent updates and for the progress you have made in Somalia. I would like to call on Dr. Reginald Nalugala to provide the country update for Kenya.
Thank you, Professor. Yes, sorry, go ahead.
Yes, I wanted to just announce that we were to have a meeting last week with in Kenya. So perhaps you also provide additional update on that.
Yes, first to say is that 2 hospitals are ready, Beacon of Hope and Zambezi. They're just waiting when we start the training. And then on the template, we are up to date. What we've been trying to see is compare different facilities we have. We have, for example, private and public hospitals, and they use different templates, how to synchronize that. But on the other hand, we are updating, we are growing very well in the template creation. Then on the side of the Ministry of Health, yes, last week was supposed to have a meeting with Nairobi Metropolitan Services, which is the city of Nairobi, but then the doctor was very busy, so he couldn't. But yesterday he called me and he said that he's very happy to collaborate with VODAN Africa. He's just waiting for his team, which is also coordinating the COVID-19 vaccination, when they come back together to propose to them, and then he'll pick 2 hospitals per sub-county. We have about 15 sub-counties, and then these hospitals will join the training. Then the last point I'm beginning to see is that when new data stewards join the team, they get very intimidated with the big vocabularies, dashboard. You're talking about ontologies. So we've been discussing how to make it easier for them not to be intimidated even though they are good experts, but to understand what we are doing and helping them to gel into the exercise of Modern Africa so that we can all grow together. Thank you, Professor.
Well, thank you very much, Dr. Reginald, for the updates and for the progress you have made. I would like to ask Aliyah, in situations like that of Kenya and of course Nigeria, where we have different formats for the different OPD forms, how do you handle the templates in such cases? Because there are some countries that you can't have a single template for all the hospitals. Aliyah?
I think this is a very good question. I think, in my opinion, the technical coordinator for the country will have to know, gather what kind of OPDs is going to be used across a certain country, and then maybe make sure that OPDs are created across health facilities, and then just handle it under the data stewards regarding the OPDs that they use in certain health facilities.
All right, so I think William is in charge of Kenya, right?
Yeah.
We'll have to know that. We'll have to know that. And additionally, I know Kenya and Somalia, for those hospitals that are already ready to go on to the next stage, it is good to identify the data clerks for such hospitals and then invite them to be part of our meetings. So they're already familiar with some of the operations. Of course, we're still going to have to train them on the usage of the system, but it's good if they're also part of the development of the system. That will also be very fine. So as a way of keeping them within the network while we wait for the implementation, it would be good to get the data clerks for those hospitals to be part of our meeting. Thank you, Jamal. Right, so we move from Kenya down to the south of Africa to Zimbabwe. I know Professor Bernard already took an excuse to go for a meeting, but I don't know if we have Kuda Kwashe here. Kuda is not here, but I'm going to be getting an update on the meeting of Zimbabwe later tonight. Perhaps I'll be able to provide an update on their behalf. Then we go back to the east of Africa to Dr. Jeremiah from Tanzania. Dr. Jeremiah, I don't see him online. Who is the technical coordinator for Tanzania? That's Tigist.
No, it's me.
It's you. Oh, I'm sorry. So Tigist is Somalia. Okay, can you provide a brief update on, it could be the technical update since Dr. Jeremiah is not here?
Well, basically, Dr. Jeremiah have provided a template, which is the cause of disease. And it's not an OPD, so I have created the template, and then so the vocabularies will be also created for the Tanzania.
Right, thank you very much, Aliyah. Thank you for the good work. And then we come back to the west of Africa. We come to the west of Africa, to Nigeria. Dr. Sakinat, would you like to provide an update on the implementation in Nigeria, your activity for the past 1 week?
Yes, thank you, Professor. For Nigeria, 6 of our hospitals are are ready for some time now. We are ready for implementation, and we have created a template on CEDAR for Nigeria, and also our vocabularies, and we have also written description, or we are in the process of writing the description for those vocabularies in the Excel sheet, so that in the Google sheet, so that we don't begin to look for the coordinators before we understand what those terms, what they meant. So for Nigeria, we are very ready. Thank you.
Thank you very much, Dr. Sakina. Thank you for the progress. Equally, like I said to the other countries, it would be good if you can get if you have identified the data clerks for those health facilities and ensure that they attend our meeting so they feel like part of the project before the final implementation in their clinics. It would be nice and we'll be happy to have them join us, at least for the Tuesday regular meetings. And if they're able to join the technical meetings as well, that is fine. Otherwise, the Tuesday meetings, the informational meetings will be a good place to have them to identify with them as they identify with the project. Thank you very much for all the updates across the countries, and thank you for your progress, for the excellent progress that has been made. It's been so rewarding and so encouraging. Next, I'm going to call on Yilin to provide the HMIS comparison. I think Yilin has a presentation. Aliyah, would you like to make Yilin, Putu, sorry if you make Yilin a host, a co-host. So in case.
Yilin now can share his screen.
Excellent.
Okay, sure. Thank you, Putu. Hello, everyone. Good afternoon. Then I'd like to update you about the health management information system comparison in Africa. And I'd assume you can see the Google Sheet file, right?
Yes, Lin, we
Okay,
can see the screen.
So according to Prof. Miriam's suggestion, we are doing this comparison of all or most of the information system in Africa. And this is the file that I've been working on with the help from Hecham. And based on Miriam's suggestion, I'd like to invite you to help complete this document, especially country coordinators who know more about like what kind of system is being used currently in a specific country. And in case if you don't know, then I guess you're going to interview the local clinic clerks. Then it's also a good opportunity to gather this information because currently all of the information is scattered without a well organized. So we think it's important to have an overview of all of the information. Then we are able to focus on some of the biggest ones and do the comparison between them and the ours supported by the VODAN architecture. Then I would like to briefly explain how this works. As you can see, here are the systems we can come up so far, including DHIS2, one of the biggest. And here is a little bit special because in some countries, only customized system is used based on the original one. So in this case, you just fill out like this. For example, OpenMRS is all customized in these African countries. Then you just put the name and inside braces. And then we'd like to know if the system is used on a national level or a regional or private level. Also, in how many or what kind of hospitals are they applied with what kind of purposes and what are the features, and since when has the system been started using. Other informations could be useful, such as the developer and data holder, founder, and the current condition. In the case of Impilo, it is apparently being implemented nationwide. Then it could be also helpful if you could just paste the link or the website of that system. Some of the systems are only available with demo, then you can just paste the link. And here are the reference of articles, literature, great literature, or websites, whatever that could be helpful. I'm going to copy and paste the link of this document in the chat. Then it would be really, really appreciated if you could just go to the link and contribute as much as you can. Thank you very much. I think this is the end of my part. Thank you.
Thank you very much, Yi. Thank you. This is really excellent. And I'm also calling on members of our community to contribute. This is a huge body of knowledge for us in this project and even beyond this specific project. But for VODAN Africa, this is a huge, since we're focusing on improved healthcare in Africa. This is a huge body of knowledge for us. I will invite all the member teams from our community to contribute to this spreadsheet. Thank you, Yi, for the excellent presentation. Misha and Dr. Sakinat, will you be happy to provide an update on the special issue, please?
Hello. So I have very little additional to report on top of what I reported last week. Susan is still editing the articles, and since she has a couple, it is taking a bit. But I've seen that 2 or 3 of them are almost finished, which would mean that we really are almost there. Just a couple more articles that need to be sent up and down again, and then we'll be good.
Thank you very much, Misha. Thank you. Are we still good with our timeline? I remember we're supposed to publish in April, but we're still good with the special issues timeline. Is there anything we can do at our own end? No, it appears everything is now with Susan.
I think Miriam is in the call, and we can best ask her that.
I can speak to that. Yeah, thank you. Yeah, I think we are not very far off. It is actually not all at Susan's end. It is also me. I need to look at a number of articles which have been coming from Misha. So I think we'll be very close for the first one. I have only been trying to get in touch with Peng Hong, which has actually also been proven a little difficult. So Francesca, that is one thing that we need to make sure that we get a conversation with her. But otherwise, for the work on the articles, the authors have been absolutely brilliant. Misha and Sakinat have done an excellent job. Susan is doing a fantastic job. So it's mostly the leadership team that needs to get its act together, especially me.
Me too. All right, Prof. All right, you and I will have to discuss on that and put things back on track. Thank you, Prof. Right. Before we take the questions, I think this would be a good time for Rudwan to make his presentation on the terminology. Yes, would you like to share your screen? Putu, can you please give Rudwan share screen?
Yes. Rudwan can share his screen.
Yes, let me get that started. Okay, so can you all see it? Can you see the presentation? Sorry.
Yes, Rudwan.
Okay, perfect. So this is actually coming from a discussion I had with Miriam. So we're really trying to get all the terminology together. And we found that some terminology, they do not have a very clear definition. So it's of real importance that within VODAN, we really try to converge to using similar terminology and also really define a specific meaning to that. So I'll give one of the examples and also integrate it into the hierarchy of VODAN. So just a very simple overview of the hierarchy of VODAN. We said at the top is VODAN. At the middle, we have the different jurisdictions. So these are the different countries that have different laws regarding data, especially the sharing of data, the storing of data. And at the bottom, we have the facilities. And each of the facilities, they can have, of course, store different kinds of data. So for example, patient data, genetic data, research data, etc. And a facility can also store different types of data. So in terms of metadata, what we're looking at, in this case, the jurisdiction is not yet integrated into VODAN. So what we're really looking at is this currently. So VODAN has metadata about the different facilities. So what kind of data the facilities store, what kind of countries the facilities are in, etc. So this is the kind of metadata you'll be looking about in VODAN. And the facilities are, of course, producing metadata about their research data. So you can think about the patient data, the genetics data, the research data, etc. And all these different data, they're expressed through those metadata templates we produce. So this really gives the structure to the data. So what we're now seeing is that we have different definitions of what really is metadata. And this becomes quite confusing for a lot of people. And it's really important that we get a real clear definition, like what do we say with metadata, and do we have different types of metadata? So just looking at a dictionary definition, this is from the Oxford English Dictionary. It says information that describes other information in order to help you understand or use it. So this may be very simple for just human interpretation, but it's a bit more difficult than it first may seem, because what exactly do we mean with information? What does you refer to? And what do we mean with understanding or using data? And all of that depends entirely on the context that we use it in. So these are really questions I also want to propose to everyone here. What is your vision on these questions? How do you interpret this sentence? And how does this all tie in the VODAN architecture? So I will provide a very simple framework, how this could be interpreted. So we have different types of metadata. There's contextual metadata. So these are really the descriptions of the data. For example, this can be a certain field in a template, and we just give a description that a human can understand. Now we have the semantic metadata, and this is really the meaning of the data. So this is typically the name of that field. For example, the patient, that could be a semantic description of that data. And lastly, we have the syntactic metadata. So this is really important for the interoperability. And this gives structure to the data. So you can, for example, think of the type of data that can be stored, or the structure of the data. For example, if you have a date format, it needs to be structured in a very specific way. And there are multiple ways to do that. So it's really important that everyone uses the same format, or we converge that to a similar format. So to give a very simple example of how these three different types of metadata come into play, and how metadata also relates to data. So for example, to the left, we see a very simple example. At the top, we have a row of metadata. So these are the semantics of the data. So the employee ID, first name, last name, identification number, and department ID. And then we have all kind of rows that are produced according to that metadata. So these are just the standard data. But if we are working with templates, we can also interpret those metadata as data itself. So here we have a column of the different semantic metadata. We have the data types and description of the data. So regarding our previous framework, these will be the semantics, so the columns. The data types would give the syntactic structure, and the descriptions will be the contextual metadata. So in this kind of framework, we can see that it gets quite more complex than just referring to metadata. There are different types, and there are also different use cases. And this especially becomes apparent when we're using the metadata templates. So this is really something for everyone to also think about, like, when you say metadata, what exactly are you referring to? And how do you use those terminologies? And to further address some of the questions we have posed here, for example, what is information, what is you, and what is using the data, I would also like to refer to FAIR. So we have findable. So this is simply, is our data well indexed? Is it discoverable? Can other people find it? So not all data is information. Data becomes information when we can actually use it. And for us to use it, it needs to be findable, it needs to be indexed, and it needs to be manageable. So another important part of that, it's accessible. So there was also some confusion on the accessible part. What this really means that we specify the rules under which data can be accessed. So can our data be accessed under defined conditions? So this definitely does not mean that we want to maximize the accessibility or the kind of the transparency that everyone can access it, but it means that we want to really make it transparent how it can be accessed and the rules under which it can be accessed. And one really important part is the interoperability. So this really refers to this question, what does you refer to? Because it can be you as a human, but it can also be you as a machine. And that's also give relevance to using data. Because to a human, this kind of contextual metadata is really relevant. But to a machine, this is rather irrelevant. So to a machine, what's important is the syntax of the metadata and the structure of the metadata. So if we're talking about interoperability, what we're really talking about, can a machine read it? Can a machine use it? And ultimately, can it also be reused? So interoperability would really refer to, is it data structurally well-defined? So is the syntax correct? And is it in a format that's common? So as a common format, you would propose within, for example, the VODAN community that we use the same structure like RDF. So when we have all these three factors, we ultimately come to reusability. And I think that's really the core of FAIR. So can others find our data? Can they access it under confined conditions? Can it then be interoperable for machines? And ultimately, can others derive accurate meaning from our data? So this is really the whole reason why we're doing this. For others to be able to reuse those research data and also share it among each other under defined conditions. So these are really the questions I want to leave with you, these three. Do you have a better understanding of what is information? What is you in this context? It may not refer to you as a human, but also to a machine. And that as well with understanding. There's of course the machine understanding and a human understanding, and both are just as important. So these are the questions I want to leave with you, and really thank you for listening. And if you have any input on this, that will be really appreciated. So we can really fine tune our definitions in the documentation of the terminology. So thank you.
Thank you very much, Ridwan, for this excellent presentation. This is really, really very excellent. Thank you. I'm sure everyone feels the same. So we'll take the questions now and have the final discussions before we close our meeting for today. Questions and then AOBs from members of our community. I'm sure Aliyah will love this Rudan's presentation because she's leading the templates and terminologies team, and this makes everything so easy, and it brings out more perspective on the idea of the template and the terminologies. Yes. Are there questions from members of our community? Comments? Yes, I've seen a lot of comments in the chats. Dr. Sakina says, thank you, Ridwan. Professor Miriam, this is really helpful, Ridwan. Thanks, Ridwan. That's excellent presentation, Ridwan. Thank you. Great presentation from Yi. Dr. Raya says, thank you. Everyone, every member of our community says thank you, Ridwan, and thank you very much. I'm going to hand over back to you, Putu. Perhaps Professor Miriam has some comments to make. We still have a couple of minutes before we close the meeting, since there are no questions and AOBs from the community.
Thank you, Francesca. Maybe I could just pick up on the point that I saw from Dr. Reginald, which I thought that was also a very good presentation by Yelene. And the HMIS would be generic, I think, Dr. Reginald. So there could be different systems that anyone could have developed. Our basic principle is that we output to the HMIS, of which DHIS2 is one. DHIS2, we know we can do it because DHIS2 accepts input in JSON and RDF. So once we have the metadata in JSON and RDF, then it is not that difficult to make sure that that is pushed, or that a duplicate of that information is included in DHIS2. So our aim is to facilitate that for any HMIS, so that we don't interrupt the current way of working in the health facilities. Ultimately, it's a little bit a double job, because if you have it in the HMIS and you have it in VODAN, in fact, in VODAN you have it already. So, but since we are also only speaking about a minimal viable product, we are not yet that mature to kind of add it onto DHIS2 or replace it not at all, and so on. So at this moment, we just want to make sure that we do not interrupt any workflow in any health facility. That is the principle there. I hope I've clarified a bit better this point, Dr. Reginald.
Yeah, I'm just making reference to what Samson and Getu presented. And I think one of the principles, the money to come, and I think Samson and Getu can always make a comment. I think the policy aspect they made a kind of a suggestion was that CEDAR does not interrogate HMIS. So if I go to a clinic and they tell me they're using HMIS and not DHIS2, it can easily create confusion, but maybe you're making clarity there. That's a question I've been carrying forward since 29th of March. And Getu and Samson can also maybe make a comment. Thank you.
But HMIS, as far as I know, is not something. HMIS is just like, I don't know if Yelene can put back that slide, but all of those systems are HMIS. So HMIS is the collection of all the health information systems. So these Impilo is an HMIS, and the EPMS is an HMIS, and SmartCare is an HMIS. So, and the HIS2 is an HMIS. No, Dr. Reginald, not in your terminology, not?
Yeah.
Sorry.
Yeah, this is Samson speaking. Can you hear me?
Yes.
I think this is where Rodol's presentation becomes recognized, right? Terms mean different things for different people. With the common use of HMIS, that is Health Management Information System, because we have different types of systems like management information systems, decision support systems, and the likes. And the Health Management Information System is commonly being used for aggregate data reporting of countries.
So HMIS, for instance, in the Ethiopian context, we had a system called EHMIS, that's electronic HMIS, which was later replaced by the DHIS2. So anyway, you can take this HMIS to incorporate many systems the way you Prof defined it, or like it's commonly used, HMIS. I think in our terminology we have been using it as a common term because different countries may use different systems for reporting.
Yes, that is how I see it, that HMIS is a collection of systems, of specific systems that are being used. And our objective is to support data input in those systems because we want to make sure that we are convergent with the current requirements. And so what the task is that the group of PUTU is doing, that's why the group of PUTU is so important, is that we need to understand in each of the health facilities what HMIS is used. So we know, for instance, in the Zimbabwe clinics, they use Impilo. We know that we have DHIS2 in Ethiopia and in the public hospitals in Kenya and in Uganda. So once we know, and then the next question that PUTU will put on the agenda, go and see in that system whether it accepts JSON or RDF as input. And then once we know that, it will be not that difficult to program. Those are the steps. So this comes under the, first of all, under the meeting of PUTU on Monday to understand the systems in use. But our collective objective is to make sure that the data goes into any HMIS that we find at the health clinics. Hopefully we can manage it. I think that I hopefully have clarified sufficiently, Dr. Reginald, or you see it still that the reality is different.
No, you're perfect. What I was actually communicating to Lee in that he has triggered some very important questions that maybe we were trying to overlook, but they're going to help us improve on what we are doing. That was my approach. Yeah, thank you.
Yeah. So in the communication to the health clinics, it means that they have added abilities by what we offer, but we don't take away anything of what they currently do or have or are obliged to do.
Right.
All right, well, that was my comment. I would also like to say that, gosh, has everybody been working hard? I think Dr. Francesca, through the weekend, day and night, Oluwola, so many people, Samson, Getu, Aliyah, of course, Putu, all of these meetings have been coming on top and over each other. Rudawan, Yelin, I forget many people, Mariam. Excellent work. So if we can keep a little bit this pace, we are on very good timelines. To some of you, I have to apologize, especially Dr. Wondimu, who I have promised that we are going to have a conversation. So we'll schedule it in, Dr. Wondimu. But really, thank you for everybody for all this fantastic effort. Thank you.
Thanks, Professor Miriam. Thanks. I will close the meeting. Thanks everyone to join this meeting. As always, the video recording of this webinar will be available this week in every channel such as website, Slack, OSF, and WhatsApp group. Thanks again for joining us. We will see you next week. Bye.
Thank you, Putu. Thanks, everyone. Goodbye.